Depression is more than just feeling down. It's a serious mood disorder that affects how you feel, think, and act. It's like a dark cloud hanging over you, making it hard to enjoy life. Depression can sap your energy, steal your motivation, and leave you feeling hopeless. Imagine feeling a constant sadness that doesn't go away. Your favorite activities no longer bring you joy. You might withdraw from loved ones, feeling like a burden. This is the reality for millions struggling with depression. It's important to remember that depression is not a sign of weakness. It's a medical condition, just like diabetes or heart disease. It's not something you can just snap out of. If you think you or someone you know might be depressed, don't hesitate to reach out for help. There are effective treatments available and recovery is possible. Depression isn't one size fits all. It can manifest in different ways, with varying levels of severity. Some people experience a single episode while others struggle with recurring bouts throughout their lives. Major depressive disorder, also known as clinical depression, is characterized by persistent and intense feelings of sadness, hopelessness, and worthlessness. It can significantly impair daily functioning. Persistent depressive disorder, sometimes called dysthymia, involves a chronic low mood that lasts for at least 2 years. While less severe than major depression, it can still significantly impact quality of life. Seasonal affective disorder, or SAD, is a type of depression linked to changes in seasons, typically starting in fall or winter. It's thought to be related to reduced sunlight exposure. Postpartum depression affects women after childbirth, causing extreme sadness, anxiety, and fatigue. Hormonal changes and the challenges of motherhood can contribute to this condition.
Understanding the causes of depression is complex, like unraveling a tangled knot. It's rarely just one factor, but a combination of genetic predisposition, brain chemistry, life experiences, and environmental influences. Research suggests that genetics play a role. If a close family member has depression, you may be at a higher risk. However, having a family history doesn't guarantee you'll develop the condition. Our brains rely on a delicate balance of chemicals called neurotransmitters like serotonin and dopamine to regulate mood. Imbalances in these chemicals can contribute to depression. Life experiences, both positive and negative, can shape our emotional well-being. Trauma, abuse, grief, job loss, or relationship problems can trigger or exacerbate depression. Our brains are intricate organs, and imbalances in their chemistry can significantly impact our mental health. Think of it like a car engine. If the fuel mixture is off, the engine won't run smoothly. Neurotransmitters, the chemical messengers in our brains, play a crucial role in regulating mood, sleep, appetite, and concentration. In depression, the levels of these neurotransmitters, particularly serotonin, norepinephrine, and dopamine, can become disrupted. Serotonin is often called the feel-good chemical, as it contributes to feelings of well-being and happiness. Norepinephrine helps regulate alertness and energy levels. Dopamine is involved in motivation, reward, and pleasure. When these neurotransmitters are out of balance, it can lead to the persistent sadness, fatigue, loss of interest, and other symptoms characteristic of depression. Medications like antidepressants work by helping to restore the balance of these brain chemicals.
Life is full of ups and downs, but sometimes difficult experiences can take a toll on our mental health. Major life changes, stressful events, and unresolved trauma can leave us feeling overwhelmed and vulnerable to depression. Imagine experiencing a significant loss, like the death of a loved one, the end of a relationship, or job loss. These events can trigger grief, sadness, and a sense of hopelessness that can spiral into depression. Chronic stress, whether from work, finances, or relationships, can wear down our emotional resilience over time. It's like carrying a heavy weight on your shoulders day after day. Eventually, it becomes too much to bear. Traumatic experiences, such as childhood abuse, violence, or accidents, can have long-lasting effects on our mental and emotional well-being. Untreated trauma can make us more susceptible to depression and anxiety.
Depression can manifest in many ways, affecting our thoughts, feelings, behavior, and physical health. Recognizing the signs is crucial for seeking timely help. Emotionally, depression can feel like a heavy blanket of sadness, hopelessness, and despair. You might experience a loss of interest in activities you once enjoyed, withdraw from social interactions, and struggle to find pleasure in anything. Your thoughts might race with negative self-talk, feelings of worthlessness, guilt, and self-criticism. Concentration can become difficult, making it hard to focus on work, studies, or even simple conversations. Behaviorally, You might notice changes in your energy levels, sleep patterns, and appetite. Fatigue, insomnia, overeating, or loss of appetite are common. You might also become more irritable, restless, or agitated.
While we often think of depression as primarily affecting our emotions and thoughts, it also has a profound impact on our physical health. The mind-body connection is undeniable, and depression can manifest in various physical symptoms. Headaches, muscle aches, back pain, and digestive problems are common complaints among those struggling with depression. Chronic pain can worsen depression symptoms, creating a vicious cycle. Depression can also disrupt sleep patterns, leading to insomnia or excessive sleeping. Insomnia can further exacerbate fatigue, low mood, and difficulty concentrating. Changes in appetite are also common, with some people experiencing a loss of appetite and weight loss, while others might overeat and gain weight. These changes in eating habits can further impact energy levels and overall health.
Depression isn't just a personal struggle. It casts a long shadow over every aspect of daily life, affecting relationships, work, and overall well-being. Imagine trying to focus on your job when your mind is clouded with negative thoughts and fatigue weighs you down. Depression can make it challenging to concentrate, meet deadlines, and maintain productivity. Relationships also suffer under the strain of depression. Withdrawing from loved ones, irritability, and difficulty communicating can create distance and misunderstandings. Simple tasks like getting out of bed, showering, or preparing meals can feel insurmountable when you're battling depression. The lack of motivation and energy can make it hard to maintain basic self-care.
Just as there are many phases of depression, there are various paths to healing and recovery. Treatment often involves a combination of therapies, lifestyle changes, and support systems tailored to individual needs. Psychotherapy, also known as talk therapy, provides a safe and supportive space to explore your thoughts, feelings, and behaviors with a mental health professional. Cognitive behavioral therapy, or CBT, is particularly effective for depression, helping you identify and change negative thought patterns. Medications like antidepressants can help restore the balance of brain chemicals involved in mood regulation. It's important to work closely with a healthcare provider to find the right medication and dosage for you. Lifestyle changes play a crucial role in managing depression. Regular exercise, a healthy diet, adequate sleep, and stress reduction techniques like yoga or meditation can significantly impact your mood and well-being.
One of the most challenging aspects of depression is the stigma surrounding mental health. Many people suffer in silence, feeling ashamed or afraid to reach out for help. Breaking the silence is essential for recovery. Remember, depression is not a sign of weakness. It's a medical condition that requires professional help, just like any other health concern. Seeking help is a sign of strength and self-care. Talk to someone you trust, whether it's a family member, friend, doctor, or therapist. Sharing your feelings and experiences can be the first step toward healing. There are numerous resources available, including hotlines, support groups, and online communities, where you can connect with others who understand what you're going through.
If you're struggling with depression, please know that you are not alone. Millions of people worldwide experience this condition, and recovery is possible. There is hope, and help is available. Remember that healing takes time, and it's okay to have good days and bad days. Be patient with yourself, celebrate small victories, and never give up on your journey to recovery. Surround yourself with a supportive network of loved ones, mental health professionals, and resources that can help you navigate the challenges of depression. Together you can overcome this and reclaim your life. Remember, you are stronger than you think, and brighter days lie ahead.